Good afternoon. I'm Regina Hoffman, Executive Director of the Patient Safety Authority. I am so excited to be here with you today to announce the 2022 IAM Patient Safety winners. Judges selected 10 individuals and teams from 129 nominations representing 66 healthcare facilities throughout the Commonwealth of Pennsylvania and across the nation. This year, we introduced 2 new awards to celebrate achievements made in SEPSIS and timeouts. We are also recognizing 2 runners-up in each category along with the winners. This gives us the opportunity to celebrate even more healthcare workers and their commitment to improve patient safety. Thank you to everyone who submitted a nomination. And now for our winners. In the first category, Safety Story, the winner is the registered nurses on 5 Cathcart Medical Surgical Unit at Pennsylvania Hospital. These registered nurses raised their concerns about the possible lack of safety and security in dispensing oral liquid methadone from the pharmacy to the unit, which resulted in a hospital-wide shift to storing the drug in the unit-based medication dispensing machine. The change allowed the RNs to remove the methadone when the patient was ready for it and enabled accurate tracking of syringe removal and wasting as with other controlled substances on the unit. In the category of transparency and safety in healthcare, the winner is the Nursing Leadership and Education Team, Physicians, EPIC Team, Patient Safety, and Library staff at UPMC Carlisle and Central Pennsylvania Hospitals. In response to an adverse event related to continuous urinary bladder irrigation, a multidisciplinary team at UPMC Central Pennsylvania Hospitals, including nursing leadership, nursing education, urology physicians, ED physicians, hospitalists, the EPIC team, the Patient Safety Department, and library representatives, created and implemented a continuous urinary bladder irrigation order set and nursing education. These were implemented at all hospitals in the region, and the event was discussed in forums and shared in a patient safety newsletter to show how transparency and collaboration can result in system improvement for patient safety. Our next category, Nationwide Warriors. The winner is the Perioperative Surgery Team at Northwell Health. Based on literature on the effectiveness of safety checklists on surgery outcomes and the potential for video recording to promote surgical quality improvement and patient safety, the team implemented remote video auditing in operating rooms. By providing non-punitive feedback to surgical teams in real time, they saw a dramatic increase in compliance with the sign-in, time-out, and sign-out elements of the World Health Organization Surgical Safety Checklist. And in the next category, Sepsis, our winner is the Emergency Department Team, Dr. Christopher Stromsky and Ryan Kloss at St. Luke's Allentown. St. Luke's Allentown's Emergency Department Team has consistently achieved high sepsis bundle compliance by engaging in process improvement, reviewing opportunities, and providing timely assessment and intervention in the sepsis patient population. The leadership team engages in monthly review of internal performance and shares this great discussion with their team. In the category of individual impact, our winner is Kristen Keene, RN, Short Procedure Unit at Phoenixville Hospital. Kristen Keene had a patient going home with multiple drains. She brought a family member back to educate them on emptying the drains and discharge instructions. The family member stated they pass out at the sight of blood and could not do it, and the patient was unable to do it for herself. Keene devised a plan to use the patient's cell phone to FaceTime another relative who could help with the drains. She demonstrated and explained exactly what she was doing and recorded the video as a reference. Keene called the patient the next day to check on them and how their caregiver was doing with the drain process. The family member was using her video as a reference. Our next category is ambulatory surgery facilities. And the winner is Jesse Hickson, MSN, Greg Purnell, MD, and the AHN Monroeville Surgery Center team at Allegheny Health Network Monroeville Surgery Center. In early 2021, surgeons were discussing that they had been experiencing an increased incidence of suture issues after surgery. Jessie Hickson, Director of Nursing, met with them and began investigating the suture issues. She expanded the investigation into the broader Allegheny Health Network and found that many surgeons in different facilities were having the same problem. Some patients just weren't absorbing the sutures, while others were developing infections requiring further surgery. In response to this widespread problem, the Allegheny Health Network contracted with another suture company to convert to a different product, and no further incidents were reported after the conversion. Our next category is timeouts, and the winner is the Pre-Procedure Timeout Task Force at Pennsylvania Hospital. In response to troubling increase in safety event reports related to surgical consent, Pennsylvania Hospital's perioperative leadership created a task force to reduce the number of safety events occurring prior to patients' arrival in the OR. The pre-procedure timeout process the team designed and implemented ultimately reduced consent and wrong site, wrong patient safety events per day by over 87%. Our next category, improving diagnosis. The winner goes to Joyce Litwack, RN, Lehigh Valley Health Network. A patient who was admitted and treated for an isolated hip fracture was to be discharged. But because her COVID test result was not back in time, she was rescheduled to leave the next day. Although Joyce knew the patient was set to leave and already had a diagnosis of an isolated hip fracture, she completed a full assessment anyway and found the patient to have left upper extremity weakness, a telltale sign of a stroke. Joyce notified the attending physician, who assessed the patient and noticed some facial droop as well. A stroke alert was called, and subsequent diagnostic scans revealed a severe intraluminal carotid artery thrombus. That's a blood clot in the patient's carotid artery. Due to the patient's inability to receive tissue plasminogen activator, a clot buster drug, without intervention, she was almost certain to have a massive and likely fatal stroke. The patient was in the operating room a short time later to remove the clot. Our next category is long-term care facilities. And the winner goes to Desiree Schuler, LPN, restorative nurse at Hometown Nursing and Rehabilitation Center. Desiree is a great safety champion who consistently makes herself available to provide staff education, even on off shifts. When it comes to resident safety, she solicits feedback from staff and serves as a role model for her peers by wearing her critical thinking cap. Doing the deeper dive related to the prevention of all incidents and accidents is the norm for her. With her leadership, falls in the facility were reduced by 25% this year compared to last year, an awesome accomplishment. In the next category, physician offices. Our winner is Melissa Baumann, CRNP at Lehigh Valley Physician Group Family Medicine in Bath. During a routine physical of a 33-year-old patient, Melissa heard a heart murmur. The patient had no medical history but shared that his father had died suddenly at 62 of an unknown cause. Though the patient had no other symptoms, Melissa insisted that he go for a 2D echocardiogram, which indicated a possible aortic dissection and led to an emergency chest scan that confirmed the diagnosis. He was admitted and underwent surgery and has been doing well. His cardiologist credits Melissa with saving this patient's life. And finally, in our last but certainly not least category, the Executive Director's Choice Award. The winner is the Healthcare Associated Infection Focus Team at WellSpan Good Samaritan Hospital. To decrease the number of central line-associated bloodstream infections and bring zero harm to patient care, WellSpan created a multidisciplinary HAI-focused team, which began process observations at the unit level to identify variations in central line insertion techniques, site selection, daily maintenance, and dressing care, as well as conduct daily assessments of all current central lines for discontinuation opportunities. They also developed appropriate blood culture order sets, education for clinicians, and an audit process to ensure coaching was available in real time. Due to their efforts, WellSpan has been CLABSI-free for 310 days and has embraced a 28% decrease in overall hospital-acquired infections. Congratulations to the team at WellSpan and to all of our winners. Thank you for everything you do.